Hi, today we are talking about drain care. A drain is placed during breast surgery to allow body fluid to be removed from the surgical cavity effectively. It can be removed once the drainage amount is minimal. Let's learn how to care for your drain at home right now.
Before we begin, please prepare 1 medicine cup, 1 plastic cup, 2 pieces of alcohol swabs, and a pen with your post-breast surgery drainage record. Let's learn how to care for your drain at home right now. Step 1. Prepare the requisites on a clean surface area. Wash and dry your hands. Sit in a comfortable position. Step 2. Clamp the tubing using the green device. Step 3. Clean the bottle cap with an alcohol swab. Disconnect the bottle from the cap. Step 4. Squeeze the bottle to pour its content into the plastic cup. Step 5. Clean the bottle cap and bottleneck with a new piece of alcohol swab. Compress and recap the bottle. Step 6. Unclamp the tubing by releasing the green device. Step 7. Measure the fluid using the medicine cup and discard the fluid. Step 8. Wash and dry the requisites to stand by for the next use. Wash your hands with soap and water. Step 9. Record the fluid amount in your post-breast surgery drainage record. If the drain tube is dislodged from the white cap, clean both the tube and the white cap tip with alcohol swabs. Then insert the tube back into the white cap tip. Recreate bottle vacuum by repeating step 1 to step 9. There is no need to go to the hospital. Contact your breast care nurse for advice. Call your breast care nurse and seek medical consultation if any one of the following conditions occur: fever of 38 degrees and above, increased redness, swelling or bruising at the wound site, excessive discharge or bleeding from the wound or drain site, severe pain at the wound site not relieved by analgesia. Fluid in the drain is bright red, cloudy, yellow or foul-smelling. Wound gapes open.
If the tubing slips out from the chest or under axilla, place a clean gauze over the drain site and secure it with a plaster. There is no need to go to the hospital. Contact your breast care nurse for advice. If you need to clarify on any of the above conditions, you may contact your breast care nurse during office hours.